Let's talk about breast augmentation and what to expect. I'm Olivia MaDan. I'm a plastic surgeon in Nashville, Tennessee. I graduated from Clemson University with an animal science degree, finished medical school at the Medical University of South Carolina in my hometown, Charleston. I trained in plastic surgery at Wake Forest. Usually for breast implants, you have two options, a silicone implant or a saline implant. A silicone implant, the majority of those are going to be the highly cohesive gummy bear implants. The reason why they get that name is because of the stability of the gel and how cohesive it is. A saline implant still has a silicone shell, but it's filled with IV fluid. There's essentially a higher risk of rippling and wrinkling that could be visible in some patients and is typically not as soft as silicone. The benefits of a saline implant are the rupture surveillance. If there's a problem with the valve or the shell itself, your body will absorb the IV fluid and your breast essentially will deflate. The majority of my patients use silicone implants, usually for how soft they feel and the lowest likelihood of having visible rippling or wrinkling. My preference is to put the implants behind the muscle or below the pectoralis major muscle and to use an incision in the crease. It's about 4 centimeters or 2 inches and it hides really well and will almost become invisible over time. Details about implants that are important to know. No breast implant, whether you choose silicone or saline, none of them are going to be considered lifetime devices. Essentially 10 to 15 years from the time that they're placed, you'll be guaranteeing yourself future surgery. Something to think about and take into consideration when you're scheduling your breast augmentation procedure. Breast augmentation surgery takes less than an hour and you go home the same day. It's done as an outpatient. You usually need a driver and someone to stay with you for the first 24 hours. Afterwards, the settling process will begin. You need to take about 2 weeks to just relax, no exercise, no heavy lifting. After the 2 weeks, you can get back to light activity. Typically, we want you to avoid underwire or anything pressing on the incisions for about 6 weeks. The full settling process where things might drop and fluff usually takes around 3 months. At your breast augmentation consult, we'll do measurements and sizing with our insert system, and I have a 3D imaging software where we'll take 3 photos of you and allow you to see different implants on yourself. At the end of your consultation, we give you access to your simulations so you can review them at home.